So at PENTAX Medical, one of the most exciting things about my role is really building the clinical affairs program globally. We recognize that the clinical affairs program is something that has to exist across all aspects of our business, across all geographies, across all settings of continuum of care. It really cannot just be limited to hospitals. It must incorporate every single practice setting where these products are used. And in the clinical affairs division, we're going to be focusing on several key issues. The first is really clinical advocacy, building the relationships, making sure we understand the needs of the clinical customers as well as the patients that we serve mutually. At 3 o'clock in the morning, you may have a need. I want you to feel confident that PENTAX Medical will be the provider, the manufacturer, and the partner, more importantly, that will be there to partner with you when you have those clinical needs. The second is clinical research. We want to ensure that you have access to the latest evidence-based practices and guidelines that exist out there across the globe. In my role, I'll be looking specifically at best practices across the world, not just here in the U.S., not just in Europe, not just in Australia, but across every single aspect that we serve to ensure that we're incorporating the latest and greatest in evidence-based practice. That will also be incorporated into our product development pipeline so that we can deliver more efficacious products that are going to be latest and breaking and deliver solutions that you're looking for specifically. Patient safety is one of the most important imperatives for PENTAX Medical as well as our customers. And most importantly, it's important for the patients that come in for healthcare delivery. We want to make sure that all clinicians, patients, and healthcare delivery systems have access to the latest in patient safety, healthcare quality, and reform information. When medical devices are used, there's always associated risk with any procedure. But what we're going to do is minimize that risk by partnering with our clinicians to provide the latest in evidence-based practice, clinical education, as well as access to clinical research. Together, we can actually make a difference. We can prevent patient adverse events, and more importantly, we can ensure the patient has a good overall experience, which ties directly back into the Institute for Healthcare Improvement, AAA.